Hi, this is Josh. I'm pharmacist with pharmacisttips.com to talk to you today about Alprazolam. We're going to talk about the side effects of this medication, that it's used for anxiety, and we're going to talk about some of the withdrawal symptoms that can occur with this medication as well. And the specific topics we'll cover in this video include what is Alprazolam, the specific uses for Alprazolam, the dosage range, the most common side effects, as well as other side effects, warnings and cautions that need to be taken into consideration, and then we will discuss withdrawal from the medication as well. With all my videos, this is informational purposes only. Always talk to your healthcare provider before making any changes to your medications. So what is alprazolam? It's in a class of medications called benzodiazepines, um, same family as things like Valium. It is a controlled substance, meaning it's subject to more regulation in the United States. It's a controlled substance because it is prone to abuse. In the US, it's sold under the brand name Xanax. Typically, the tablets are available in 0.25 milligram, 0.5 milligram, 1 milligram, and 2 milligram tablets. It's available in the regular tablets, XR or extended release tablets, as well as disintegrating tablets, tablets that can just be put on the tongue and dissolve, no need for water. It is also available in a liquid solution. I don't see that used very often. The uses for alprazolam: anxiety. It is a strong sedative. It has a strong sedative calming effect. It's also used for panic disorder, and it is sometimes used for the symptoms of alcohol withdrawal. And you may see it used for other items too. Sometimes it's used short term for sleep issues, things of that nature. The dosage: it is best to use it extremely sparingly. So ideally, the lowest dose for the shortest amount of time that's effective. For anxiety, the literature suggests a maximum dose of 4 milligrams a day. Panic, up to 10 milligrams a day. That's a very high dose. I don't know that I've ever seen anyone on 10 milligrams a day, but the literature does allow for up to 10 milligrams per day in severe panic conditions. Initially, the dose is started at 0.25 milligrams up to 3 times a day, but again, sparingly. Oftentimes it will be labeled, as only as needed, up to 3 times a day. Most common side effects: drowsiness and fatigue, sedation. Those can occur in over half of people who take it. So certainly something to keep in mind. Most people would not want to drive or operate machinery after taking this medication, at least till they fully understand how it affects them. It can also affect memory in 3 out of 10 people who take it, so they could have some memory issues. Other side effects can, of course, include sleepiness. Weight gain can occur with this medication. It can also increase appetite, constipation, cognitive dysfunction, thinking problems, cloudy thinking, confusion. It can decrease libido. It can also lower blood pressure. It can sometimes cause heart rate or palpitation issues, blurred vision, rash, and other side effects can occur as well. Some of the warnings: it's important to remember this medication is very good. Anxiety can be crippling. Panic can be crippling. But dependence can daily use for only 10 days, and you can become dependent on it. So it's trying to find the perfect balance there of helping you live your life, but also you're at risk of becoming dependent on the medication when you use it every day. It also is riskier for folks as we get a little older. It can impair cognition, again, that thinking. It can even make it look like signs of dementia in some people. It increases the risk of falls and fractures. It can make folks a little unsteady, increase the risk that you would fall and break a bone, and other impairments can occur. Want to absolutely avoid using this with alcohol. Use with alcohol can result in you could stop breathing, and so it can be very serious. And avoid with opioids like hydrocodone, oxycodone, those sort of things. We do see them used together, but it puts one at a higher risk of respiratory depression, again, problems with breathing, as well as extreme sedation. And in Some cases, coma and death can even occur. So definitely something where one would want to keep an eye on the dosage. Make sure you're getting the medications from the same doctor, same pharmacy, so they can kind of keep an eye on you, make sure everything is in the appropriate range. Withdrawal can definitely occur, especially the longer you've been on the medication. Stopping abruptly, you can get rebound symptoms. Your panic, your anxiety can come back. You can even get seizures depending on the dose and how long you've been on it if you were to stop this abruptly. Typically, they recommend decreasing the dose by about 0.5 milligram every 3 days. So you'd want to taper off of this medication. I do thank you for watching. Please like the video if you appreciate this kind of information. Subscribe to my channel if you like videos like these. And if there was something I didn't cover in the video, please ask questions below and I will do my best to answer them for you. Thank you again for watching.